to young girls. But we began this half hour with the emotional debate over prenatal testing.
One of the things that you don't know about Obamacare and one of the mandates is they require free prenatal testing. Why? Because free prenatal testing ends up in more abortions and therefore less care that has to be done, because we cull the ranks of the disabled in our society.
That was one of a series of recent comments from Rick Santorum, citing prenatal testing as one of the reasons he is against the president's health care law. He followed that remark made Saturday with a similar statement on CBS's Face the Nation. Well, the ChristianPost.com has an article with the headline, OBGYN. Santorum was right. Prenatal testing used to abort disabled. The website uses a quote from Dr. Jean Rudd, who says, what prenatal care is developed into is a search and destroy mission. Joining me now is Dr. Marjorie Greenfield from University Hospital's Case Medical Center. Doctor, thank you so much for your time. I should note your hospital is one of the leading neonatal care facilities in this nation. I don't want to get you locked up in a political or religious battle here on any level, but I do want to talk about the science here. And you've got one of, not your colleague at the hospital, but another OBGYN who's saying that this is a search and destroy mission. What is your response to that?
That's really a terrible way to frame prenatal testing. Prenatal testing is much more than about abortion, and I think when you narrow it down that way, it's really politically motivated as opposed to actually talking about what happens with patients.
What are the numbers here? Rick Santorum has said that this results in most abortions when testing is done. I've read countless articles of the last 10 days, or when he first, 5 days when he first came up with this. And I have to say, I've not seen a clear figure here. You tell me.
You know, the decision about what you do with abnormal results is a very personal decision. When you talk about prenatal testing, first of all, we have to say, what are we actually talking about?
Right.
Because there's a range of testing, and ultrasound is a prenatal test that can detect fetal abnormalities. The other testing they're talking about are blood tests that can be done, and then ultimately an amniocentesis or chorionic villi sampling, which are the diagnostic tests that give you the true sort of final answer of what's going on with chromosomes. Those tests, I think what Rick Santorum was talking about primarily was amniocentesis when he specified about it, but he used the term prenatal testing, which is a much broader term than that.
I know that you've written about how emotional this is. Some families decide they don't want to do testing because they don't want to face the decision of what to do next. And we talk about this in the stark terms of numbers, but it is a person and a family's choice here. You're in contact with people every day who decide on testing. Just take me through your world and the perspective of what women are looking for when they decide to go ahead with this.
Well, when I frame this with patients, I say basically that I think people fall into three groups. There's a group of patients who don't want to do any of this prenatal diagnostic testing or screening because they know that they would not change their behavior at all based on the results, and they don't want to be worried about this during the pregnancy. There's another group that knows that they would terminate an abnormal pregnancy, and they want all the information that they can get so they can make that decision. And then there's a very large group in the middle that wants to know about the health of their baby so that they can make the best possible decisions. They might decide to get in contact with a support group so that they would learn more about this condition so that they could make a really good decision about what to do for themselves. Or they might, you know, sometimes we're talking about a condition that's not compatible with survival. Sometimes we get hospitalized during the pregnancy for people who would not terminate a pregnancy, but who want as much support as possible when it comes down to those final hours with their baby. So the situations, these decisions are incredibly personal decisions. The other thing I really want to make sure people understand is that amniocentesis is typically done for anybody that's at increased risk of finding a problem. But most of those people are carrying healthy fetuses. So one of the biggest purposes of amniocentesis turns out to be reassurance for the families that their baby does not have a chromosome problem and that they can go through the pregnancy with less worry and concern.
So in most of these cases, the baby is healthy?
Oh, the vast majority of amniocentesis does not find a problem.
You've said that overall, though, this is commonly accepted, and one of the quotes that you had is that this is like not covering an ultrasound, the ideas that are coming from Rick Santorum, and that he would not want insurance to cover this prenatal testing.
Well, right, because you can do an ultrasound and find a very severe problem on a fetus that would not even be detected by amniocentesis. It's just an anatomical problem that can be very, very severe, not compatible with survival or not compatible with a quality of life that a family might choose to go forward with. And I'm not sure what it means to say you wouldn't want to cover amniocentesis, but you would cover ultrasound. I mean, would that mean that then the doctor would be not supposed to tell the family that this abnormal finding was there because the family might make a decision for abortion? It goes, you know, sort of when you extrapolate from this, you end up going down a path that really interferes with the doctor's ability to take care of the patients and the family's independence. And
it's a rejection for some of science here. I mean, this is science used to, as you pointed out, help with the mother to have a healthier child in the end here. And if insurance doesn't cover it, that would mean only the wealthy perhaps would have the ability to have this testing done, because I would imagine this is quite expensive.
Yeah, I actually looked into it, and you know, there's quite charges, of course, across the country, but we're talking around $2,000, and that's really going to be unreachable for a lot of people.
So if you were rich, you'd be able to do it and have this testing, but obviously the other, you know, 99%, as we like to say, would not.
Right, and so what you could end up having, for instance, I can give you an example of a patient who has a routine ultrasound. They see something that makes it more likely that you're going to find a serious chromosome problem, and then the family would have to make a decision: are they going to spend the money for the amniocentesis, or are they going to just be terrified for the rest of their pregnancy, when it could turn out to be just fine?
Well, Dr. Greenfield, we greatly appreciate. We've been trying to get you on for 2 days, and I'm happy you were able to make it today with your factual knowledge on this issue. You see it every day. Thank you so much.
Happy to be here. Thank you.
Well, the hot button issue of race in college admissions is headed back.